All right, welcome everyone. We're still letting a couple people in, but I'll say again that we have the Spanish language option available if you want to adjust your language options. We also have ASL if you want to adjust any of your video options. We do have the correct ones, so you can leave it as is with us. And I think we're about ready to start. Okay, so thank you for joining us today for our COVID-19 update. We will go through the presentation first, and much like always, then we'll end with the Q&A. We will use the raise hand function to ask questions, and at the end, I'll call on you, have you say your name and your outlet, and then you can ask your question. I know a couple of you have asked for permission to record, which we're getting that all situated right now. All right, I think we are all ready to start. Okay, joining us today, we have Dr. Rachel Herlihy, State Epidemiologist, Scott Bookman, COVID-19 Incident Commander, and Scott Sherman, Brigadier General. And I'm going to go ahead and toss it over to Dr. Rachel Herlihy.
All right, good morning, everyone. So I'd like to provide you with a quick update today on our case numbers, hospitalization numbers, and also spend a little bit of time talking about how Colorado numbers compare to trends that we are seeing nationally right now. So this figure shows you our case counts on a daily basis. So each of those gray vertical bars represents daily case counts in the state. And then the red line is showing you our 7-day moving average number of cases. We use that 7-day trend to kind of help smooth out some of the data. So what you can see by looking at that 7-day trend is that we did see a clear increase associated with Christmas and New Year's, but we've come down since then. So we have this clear downward trajectory, and we've really been in a pretty good place, consistently seeing a downward trend for the last 2 weeks or so now in the state. Next slide. Compared to other states across the country, Colorado is in a pretty favorable position right now. So you'll see that we are about the 10th from the bottom right now, as far as our overall position with the number of cases that we've seen in the last 7 days compared to other states. Some areas of the country where we are seeing higher disease trends right now. Certainly Arizona stands out, some southeastern states, also some states in the Northeast are seeing increased rates at this time. Next slide. Similar to our case counts, our hospitalization trends are also looking quite favorable. We've seen a steady decrease in hospitalizations over the last few weeks. We didn't really see as clear of an increase associated with hospitalizations that we saw with cases in the state. Some of that may be due to the fact that many of the cases we saw occurring around Christmas and New Year's tended to be among younger age groups. But you can see in this data a little bit of a plateau that occurred in our hospitalization data. But once again, we're on the downward trajectory for about the last 2 weeks or so. Next slide. And this figure shows you trends for US cases compared to Colorado cases. Again, you can see that Colorado is doing quite well compared to overall national rates. But even nationally, we are seeing a clear decreasing trend in the US right now. Overall, Colorado's rates are lower than national rates, but we are tracking pretty closely with the overall trajectory that we're seeing across the country right now, where really both, the US and Colorado in the last 2 weeks has seen a downward trend in the number of cases. But looking at this figure, I think it's also important to keep in mind that overall, our rates do continue to be quite high. So if you look at rates now compared to other periods of time in the pandemic, obviously we continue to have high rates of disease transmission, a high prevalence of cases still occurring in Colorado and the US. And we know that it's really going to be many weeks and months to come before we get back down to the low levels of disease transmission that we saw this summer. In fact, our modeling data and national modeling data are really all telling us that it's going to be probably until at least this summer that we really need to continue all of the strategies that we're using. So mask wearing, social distancing, the contact tracing efforts we have underway to really try and control transmission of COVID-19. We know that vaccine is coming. It's the light at the end of the tunnel. But as we're building the percentage of the Colorado population and the US population that is vaccinated, those other strategies really continue to be critically important for months to come to minimize the number of cases, hospitalizations, and deaths that occur in the state. Next slide. Thank you.
Hi, everybody. As Dr. Hurley just indicated, we are moving as rapidly as we can on our vaccine mission. It is, our tool towards ending this crisis, but we do have a long way to go. Our vaccine mission is three-pronged. We want to ensure that we have a rapid deployment of the vaccine with a strong focus on equitable distribution. We want to make sure that we're saving as many lives as possible as quickly as we can. And we want to do this rapid deployment to end the crisis brought on by this pandemic as quickly as we can. Next slide. So our goal, our wildly important goal as a state right now, is to ensure that 70% of Coloradans who are 70 and over are vaccinated by February 28th. We also want to make sure that we have a community-based clinic in 50% of the top 50 census tracts for high density of low income and minority communities. Our strategy and our framework to do this is deploying vaccine to a number of different providers to ensure that we provide access to all. And so currently, we're sending about 60% of our vaccine each week to our hospitals and to our retail pharmacies. We're sending about 15% of the vaccine to our community partners and local public health agencies, another 15% to our federally qualified health centers, and then we reserve 10% each week for the combined CDPHE and Governor's Office Equity Task Force. Based on what we have seen to date, this is the best distribution of vaccine across all of our providers to ensure that we can achieve our goal of equitable distribution and getting 70% of Coloradans over 70 vaccinated by the end of February. Next slide. So one of the keys to getting people vaccinated is making sure that people know where they can go to get vaccinated. We have created a new toll-free number, 1-877-CO VAXCO, COVAX-CO. And this vaccine call center has staff that are trained to answer COVID-19 vaccine-related questions, provide information about COVID vaccine providers, and give general information about COVID-19. We currently have 50 operators available to answer calls. Currently, we're open from 9 a.m. and 10 to 10 p.m. Monday through Friday, with Saturday and Sunday, 9 a.m. to 5 p.m. By February 1st, we will extend to 24 hours a day, 7 days a week. Next slide. We have updated our vaccine data dashboard on our website. This dashboard now includes vaccine administration by race and ethnicity, age group, and sex. Each day, that dashboard will be updated at 4 p.m., include all of the information from our previous day. Next slide. And I will turn it over to my partner, Brigadier General Scott Sherman.
Hey, good morning, everybody. Just want to give you a quick update. As Scott mentioned, our whole goal in this is to distribute and administer a vaccine throughout the state as quickly as possible. Just kind of give you an update from the CDC website that probably most of you are familiar with, that right now Colorado's 9th in per capita of doses administered by states. That's 7,545 doses per 100,000 population. We're 16th in total doses administered. That's pretty good with us being 21st in state population. As of this morning, we have over 458,000 doses administered. That's 99.7% of all the first doses that we have in the state. So we've actually reached the point where we're relying on the federal government Operation Warp Speed as we get doses every week. So we are starting to receive our 76,000 doses, first doses that we're getting this week. And we have almost 83,000 second doses administered. So you'll see that's 2% of the entire nation of total dose one administered, at 375, a little bit over 375,000 total dose one administered, and 2.5% of the total dose two administered. So we're doing extremely well, and actually FEMA Region 8 is actually doing extremely well as compared to the rest of the nation. Next slide, please. I kind of just want to give you an update here where we sit on, update on phases. Phase 1A, we consider complete. We're tracking 85% of the 76,000 of the first doses and second doses administered to our frontline healthcare workers. As far as the CVS Walgreens, the federal long-term care facility program, we have 98% of first clinics done for the skilled nursing facilities. They are working very hard. They had a lot of clinics this weekend on assisted living facilities with the goal of being done with all first doses, both in the skilled and assisted living facilities by the end of January, and to also complete all second doses by the end of February. So we're on track there. Things are going well. We certainly appreciate the effort that CVS and Walgreens have done and the communications they've had with us and working as hard as they can to get that population, that really vulnerable population, vaccinated. Next slide, please. So this just kind of gives you an estimate of phase 1B, both above the line and below the line. Above the line, the 125,000 of the rest of the moderate risk health care workers and EMS first responders, and then the 562,000 in the 70 plus per population. That's all above line. And then the 628,000 that we have below the dashed line. Right now, we got over 311,000 of the moderate risk healthcare workers and EMS first responders, and the 70 plus population vaccinated with first dose. That's well over 100,000 of 70 plus. So we're well on our way. Still planning to have 70% done of all 70-year-olds second dose complete by the end of February. Next slide.
All right, thank you all for the updates. We really appreciate it. Now we'll take it over to the Q&A part of our presentation. For this, we'll use the raise hand function. I'll call on you. If you could say which outlet you're with, I will unmute you and, your name and which outlet you're with. And we're gonna start with Seth.
Hi, thanks. Seth with the Colorado Springs and Denver Gazette. Had a question about the new B117 variant, just because there's some reporting out of England that it's more deadly. I'm curious if CDPHE is concerned about that and if there are any different measures we should be taking to limit spread of it. Thank you.
This is Rachel. I can take that question. Yeah, that is a great question, and certainly new concerning news out of the UK. So just for everyone else. So we certainly believe, based on what we're hearing from the UK, that the B117 variant is more transmissible. And as you indicated, we're now concerned potentially that it could be more severe. So at this point, we are aggressively investigating all cases of the variant that we identify in the state. So using aggressive case investigation and contact tracing resources, isolation quarantine orders, all of those strategies to really limit transmission of this the variant in Colorado. Certainly something that we are concerned about. We're paying attention to the literature as it's evolving and making sure that we're doing what we can in the state to limit transmission.
Great, thank you. Meg, I'm going to take it over to you.
Hello, this is Meg Winketer from the Denver Post. At this point, have you decided, when we get below the dotted line, how is there going to be any organization within that category of frontline essential workers? You know, does it also include trying to get people who are older and still working first, or people whose job might have fewer ways to protect them than others? Thank you.
I could start out with that initially. You were a little broken up there, but so yes, actually we're working hard this week to actually start the planning. Well, we are actually get it together on what we think the priorities are for phase 1B below the dashed line. Teachers are actually going to be the first priority from there. Pre-K through 12 and childcare workers, that's going to be our number one priority to make sure we can get in-class learning. And then we plan to have that information out later this week.
Thank you.
Great, Vinny, I'm going to take it over to you. And if you could say which outlet you're with.
Thank you very much. This is Vinny Delchuris at Bloomberg News in Denver. I have two questions today. First, for Dr. Herlihy. You say that tough restrictions will probably continue in place until summer. Will there be any consideration, perhaps, of tweaking some of these things, such as social distancing or lockdown regulations? And then for Mr. Bookman and General Sherman, are there any fresh indications that seniors are having trouble navigating the vaccine system, as they're the key group right now? Thank you very much.
Yeah, this is Rachel. I can start. So, I would say that, from an epidemiologic perspective and a disease control perspective, we, believe that we will continue to need disease control strategies to limit disease transmission. And so that, of course, means mask use, that means social distancing strategies. But I would probably turn to others on the panel to talk a little bit about how that might be translated into state level policy, or perhaps that's a conversation for another media avail. I'm not certain.
Yeah, I would defer other policy conversations to the media info at state.co.us. As far as your second question around seniors and navigating this system, we've opened up this new call center. We are working with all of our providers to make sure that they have phone numbers, that they have web portals that are open. We are moving as rapidly as we can with all of our partners to ensure that all who are qualified and eligible to get the vaccine at this point have access to that vaccine. And then we're looking at different models of delivery. We are seeing people go to their healthcare provider. They're going to hospitals. We're seeing people start to have access to this at retail pharmacies. We're seeing some of these community events that are being set up, and then evaluating some of the larger drive-through sites that we saw the trial with UC Health in the city of Denver yesterday. So doing all that we can through a multimodal approach, both from a scheduling perspective and then from a vaccine delivery perspective.
Yeah, I think the only thing I would add to that is we've, after hearing from Warp Speed, we welcome the increase of allocation of vaccine and the availability of vaccine here in February. We certainly have the capacity in the state, both between the pharmacies and the local public health agencies and the hospitals, to ramp up considerably. So as soon as we can get more vaccine, we're ready and certainly welcome it.
Great, thank you. Chris, we're going to take it over to you.
Chris Vanderveen with 9 News. First is just a statement. I'm wondering if we could get some help with the data release with the vaccine distribution. Could we also is it possible to get allocation to the state as well? We're having to rely on outside sources for vaccine allocation. It'd be helpful if we just got a central place in Colorado to do that. That's one. The second is actually a question. Are we still sure that everyone who is in a process of getting the first dose of vaccine will still be able to get the second dose of the vaccine without any delay, in light of all the changes that have been taking place with the governor's plan and other plans to sort of speed up the process? Are we still sure that the second dose is still going to be on its way for people who are waiting for the second?
Yes, Chris, they are. We made sure. That's why we only said it was approximately 20,000, both Pfizer and Moderna, because we were able to any hospitals or any of the healthcare centers that actually made plans with us to move vaccines up from second to first dose. We've actually got a plan to backfill them here as soon as they need it. So that's the reason we did that number, just to make sure that we could meet the demand for the second dose. So no issues there.
Great, thank you. And I am going to go to KCNC News. If you could say your name, that would be great.
It's me, Jacqueline Quinn. And, one of the things that's worrying right now, if we're following reports across the country, is we're hearing about a lot of these mass vaccination sites. We have one planned later at the end of this month, but in New York, they've actually said that they've had to put theirs on hold because the CDC says that they cannot supply, they have to fix this issue of procuring enough of these vaccines. And so how do we know we're going to have enough vaccines to do all the things that we want to roll out here, especially that major event coming up?
So UC Health already has the doses for that. We've made sure they have the doses on hand for that. That's actually part of their second dose that they're moving up to first dose that we've actually already confirmed in weeks ahead that we'll get back to them. So no issues on that. And any large events, we certainly ask that that all anybody that's planning a large distribution event, that they plan that at least 2 weeks. We'd certainly like 3 to 4 weeks ahead of time, just so that we can make sure that we allocate the right amount of doses to them. So far we've had zero problems, but ours is certainly not as big as New York is talking. We're talking UC Health is the largest so far with 10,000 doses. So, 5,000 per day next weekend or this coming weekend. So no issue there so far.
Well, just to add on to that, we have asked the feds to send us as much vaccine as they can. We know that we can push more vaccine through than is currently available to us. Unfortunately, there is just a limited supply at the federal level. And so, we make do each week with what we have. And, this is a whole state effort. And this has been a remarkable partnership from the beginning of our COVID response with our local public health, with our healthcare providers, with our large hospital systems. And, I think we saw that in our event with UC Health yesterday, in the future planned events with UC Health. We have other healthcare systems, we have other local public health, other community partners who are all working together to make sure that we are doing this in the best way for Coloradans and ensuring access for all.
Great, thank you. Blair, I'm going to take it over to you.
All right, hi, it's Blair Miller with Denver 7. This isn't so much about vaccines or anything, but we're about a year out from our first 2 or 3 cases being investigated last year, and kind of the first signs from you all at CDPHE of what was to come. But at that point, it was low risk, not a lot to worry about. I'm just kind of wondering on, a year later, how are you reflecting on, those early days and kind of what's happened since then?
Well, I'll start, and then Rachel Herlihy and I have been in this since the beginning. And you're right. I think from our perspective, it's been more than a year now that we have been monitoring this coronavirus, and it's had several iterations of its name until it became COVID-19. And it has been a long and difficult year for our country and for the world. COVID-19 has changed everything as we know it. And I reflect back with incredible gratitude on how all Coloradans have come together to follow public health guidance, to sacrifice for themselves and for others, and so that we can save as many lives as possible. It has been a long year. There has been an enormous amount of tragedy. Thousands of Coloradans have died because of COVID-19, and hundreds of thousands of people have died across our country. But there is a light at the end of the tunnel. There is a vaccine that came to market faster than any vaccine has come online in history. It is safe. It is effective. Colorado is performing incredibly well in our administration of this vaccine. I think as Dr. Herlihy indicated, we've got several more months to go before this vaccine has, we have enough of it to administer it widespread. We do need Coloradans to continue to follow our public health guidance and, wear a mask and keep your distance, wash your hands, stay home when you're sick, everything we've been asking everybody to do for almost a year now. We need a couple more months to get this thing under control. And so, we are in this together. We have been in this together from the beginning, and we've got a couple more months of working together to get this done.
Dr. Herlihy, before I move on, is there anything you want to add?
Thanks. I think Scott summarized it really well. It's certainly been a challenging year. We've learned a lot. We've had to modify our response multiple times over and over again to really try and keep up with what we are learning about this virus. And Yeah, I think Scott summarized it well, so I'll just leave it there. Thank you.
Sounds good. All right, Jocelyn, I think I'm going to take it over to you, and if you could say which outlet you're with.
Oh, sorry, this is Jacqueline Allen. I'm with Denver 7. And I wanted to sort of reach back out about the hotline. We saw that you guys started the new hotline. That's great. When does that start? And will this be enough? We keep hearing from seniors who are struggling to figure out how they can get the vaccine. Will this answer that question?
It is one additional tool in our toolbox to provide answers to people. We know that not everybody has tech savvy, and we not know that navigating a website, navigating a portal is not always the easiest way for people to access the system. So by providing this centralized hotline, and then also our expectation that all COVID vaccine providers will have a phone number and a web portal that's open to the public for registration, we believe are important next steps in providing access to all. I think the biggest challenge here is there just isn't enough vaccine. And it is incredibly difficult for all of our providers to create wait lists for, what is literally several million people. And so we understand that frustration. We're doing all that we can to continue providing all these different points of access. And our providers are providing these signups, and many of them are then using a lottery system that when it is your time, you'll get that notification. And so it's going to require some patience. And again, if we could have 5 million doses of vaccine tomorrow, we would take it. We have said that to our federal partners. It just isn't available right now. And, we're getting allocations each week, in the tens of thousands of range, not the hundreds and not the millions that, we want to get it to.
Great. Okay, Kelly, I'm going to take it over to you.
Yeah, this is Kelly Lyle with the Fort Collins, Colorado. And kind of along those same lines as what Jacqueline was just asking, was there any thought early on to find a way to do this other than online? Because that seems to be a huge frustration of these 70 and over people, is that the phone lines were swamped. Nobody had the phone line capacity. They don't have internet capabilities. And there's a lot of them that are still kind of spinning or have given up even trying to get on these lists or get signed up. How do you reach back out to those people? Is this phone line going to take care of that and get them on lists?
This phone line is one of our tools, and this phone line is going to allow people to navigate this system with a bit more ease. And what this phone line is going to give them is providers who are in their zip code who have vaccine, and give them their phone number and give them their website so they can start trying to access the system in that way. We're also continuing to do our outreach through our federally qualified health centers, through our our community partners, and really outreaching to people who are continuing to struggle, and working through getting them enrolled in some of our community targeted events that we're putting on. And we've heard that there were significant wait times on the original hotline. This new hotline that we've stood up will have significantly more operators, and therefore we'll have a much shorter wait time, decreasing that frustration, getting people access to providers who actually have the vaccine.
I guess kind of what I'm wondering though is, are they going to be able to get on a wait list by calling this hotline, or are they just going to get another list of websites and phone numbers to go to, which is what seems to be frustrating most of them, including some 80-year-old in-laws I have in Boulder, and my own mother in her 70s.
Right. So at this point, we are not keeping a centralized wait list for the entire state of Colorado. We are referring people to individual providers who have the vaccine, and it is their responsibility to do the scheduling.
Okay.
All right, thank you. Lori, I'm going to take it over to you.
Thanks, Heidi. Lori Lizarraga with 9 News. I heard that you guys mentioned that you're going to start releasing the demographics of those who have been vaccinated. Can you talk to us a little bit about what those look like so far?
You want to take that one, Scott, or you want me to take it?
I think we have that slide in here. If you go up a couple slides, you could see that within it's on the public facing site too. The only thing I would say with it is with it's predominantly healthcare workers and our first responders, so it's a little bit skewed as far as, I wouldn't say skewed, it just mirrors what the population of that demographic looks like. And we will also be putting out here within this week what the race ethnicity data is for the 70 and above population. And that's really critical for all of us working with the providers to make sure that they accept anybody that has an appointment to come in, get vaccinated. They don't require an ID. They don't have to be a member of that healthcare system. Equity is by far our biggest priority, to make sure that the underserved population gets the vaccine just like anyone else. So that data, the ethnicity data is there, and then the ethnicity data on the 70 above will be posted later this week.
Great, thank you. Gabrielle, I'm actually going to take it over to you, and then we'll go to second round question, folks.
Got it. Thanks so much. My first question is for Dr. Herlihy. Just a quick follow-up on one of the questions that was asked earlier. In regards to that UK variant, now that it is believed to be more deadly, what's the status of the people who contracted it here? And also, can you expound a little bit about how the state is mitigating the spread of that?
Yes. So I guess the first thing I would want to say is that, the number of cases we've had so far here in Colorado has been small. And because of that, I don't think we necessarily would rely specifically on Colorado data to understand the transmissibility or the severity of this variant at this point. So I think really our best bet is to look at some of these studies that are being published to try and understand if we are seeing more severe outcomes or more transmissibility. So I don't think any conclusions that we can make from Colorado data at this point. So the things that we are doing in the state right now, the first thing we're doing is making sure that we have a statewide system in place so that we can identify these variants when they occur. So right now we have a number of hospitals, 14, I believe, hospitals across the state that are submitting samples to our laboratory on a regular basis. And our laboratory is doing sequencing on about 100 to 200 specimens per week to really try and identify how common this variant might be in the state. And then when we do identify cases that are due to this variant, we are, prioritizing those cases for case investigation and contact tracing, and making sure that we have the ability to identify where they may have potentially been exposed and who all of their contacts were, to make sure that those individuals are placed in quarantine.
Doctor, is there a certain amount of people right now that you can share with us who've been exposed to it or who've contracted it?
Yes, so that information is available on our website. So right now we are reporting 10 variant cases have occurred in Colorado.
Got it. And then my second question just surrounds Merck's vaccine trials. We know that they actually stopped with the production on that. And as you all were mentioning today, a lot of what Colorado plans to do going forward relies on just having the vaccine availability. So does this sort of dampen optimism surrounding vaccine availability in the state, seeing how Merck's failure went over?
I can answer that. No. Right now, we're being told that the Johnson & Johnson, the Janssen vaccine, the 1 dose, will be submitted for their EUA, their emergency use agreement, at the end of this month, and it'll probably be end of February when that'll be approved, is what we're being told. And if that does get done, then as soon as it's approved, there'll be 4 million doses a week of that vaccine. And if Colorado gets its share, if it is indeed 4 million doses a week starting in March, then that'll be about 67,000 a week for Colorado. So yeah, that's part of our equation. Haven't had any, we have no discussion, don't know anything about Merck. We're just focused on the Johnson & Johnson vaccine, and then AstraZeneca as that comes into play, and what their efficacy rates are.
Great, thank you. Noel, I'm actually going to jump over to you and then we'll jump into everybody's second questions.
Thanks. This is Noel Brennan with 9 News. Just to follow up on question about the second dose of vaccines in the state, are you guys hearing the same concerns we are from folks who are worried about not getting that second dose as scheduled? Just this morning, for example, we heard from a woman whose mother is in a nursing home in North Glen and was told that she wouldn't be able to receive the second dose as scheduled. Walgreens is the company that's doing the clinic there. And so I guess my question is, what are you guys doing to hold those companies accountable to make sure that folks are getting the vaccines as scheduled, the second dose?
Well, I guess I'll start off they have CVS and Walgreens have already gotten our allocation. They have over 100,000 of our first doses. So that also includes the over 100,000 second doses. We still have 19,500 of the first doses that we're allocating to them. They don't need it yet. So we're waiting to February to do that. So they have the vaccine on hand for the doses. And CVS and Walgreens have scheduled 3 clinics with every skilled nursing and assisted living facility. And that's to make sure that any people that, whether they be residents or staff that weren't there for the first clinic, they can get the first dose. They can get their first dose for the second clinic that they're there and then complete it on the third clinic. So they have everything scheduled. There's a plan for them to be back 21 days later to do second dose for Pfizer. So there shouldn't be an issue there.
All right. Well, I want to, I also want to say that I believe that there was a question about the additions to the data for race and ethnicity, and we can send over some more information on that, which we can do through media info. We're also out of time for today, so if we did not get to your question or your second question, please send that over to media_info@state.co.us. And with that, I want to say thank you to Dr. Herlihy, Scott Bookman, and General Sherman for your time, as well as our interpreters, both ASL and Spanish. And again, please send those questions over to media_info@state.co.us. And with that, have a great rest of your day. Thank you.